I'm Mike Freiberg. I'm one of the senior staff attorneys with the Public Health Law Center. I'm also the interim lead attorney for our new contract with the state of New York, which will be known as the Center of Excellence in Tobacco Policy. And I've worked at the Public Health Law Center for nearly 16 years, and I'm really excited to be working on this project. Can't say how great it is to be working with so many of you. I've heard great things about the work that you're doing already, and really looking forward to taking a deep dive into some of the work you're doing. So the purpose of this webinar is to introduce you to the work we do at the Public Health Law Center, to let you know how we do it, and also to introduce you to the people you will likely be working with. So just by way of very quick introduction, the Public Health Law Center is located at Mitchell-Hamline School of Law, which is in St. Paul, Minnesota. And we think it's important to acknowledge that that is in the Bdote region of the traditional homelands of the Dakota people. We recognize that the land we currently occupy comes with a legacy of genocide and trauma that was caused by US law and policy applied to American Indians. At the Public Health Law Center, we collaborate with others to reduce and eliminate commercial tobacco use, promote healthy food, support physical activity, and address other causes of chronic disease. We partner with tribal health leaders, with federal agencies, national health advocacy organizations, state and local governments, planners, researchers, attorneys, community coalitions, and individuals working on public health issues to create healthier communities around the country. As its name suggests, the Center of Excellence in Tobacco Policy will be focused on addressing the harms of commercial tobacco. So I'm going to turn it over now to Joelle Lester, our Director of Commercial Tobacco Control Programs, to talk about our commercial tobacco team.
Hi, everyone. Thank you for joining us today. I'm so glad to be with you. I know I speak for our whole team when I say we are thrilled and honored to get to partner with all of you in advancing health and health equity through policy change in New York. It's been a little bit of a long time to get this to the point where we can actually interact with you. And so we're just really thrilled to kick things off. So I'm Joelle Lester. As Mike said, I'm the Director of Commercial Tobacco Control Programs at the Public Health Law Center. I've been at the center for about 10 years. And I've had a chance to work in several of our program areas, but all within commercial tobacco control. And so I'm going to tell you just a little bit about how our commercial tobacco programs are organized. But I want to stress to you that you're like the new member of the family at the Public Health Law Center, and something that we really pride ourselves on is that we have a lot of different funders. We work in a lot of different program areas, and we like to bring the benefit of all of those resources to bear for you, for the folks in New York, working at the community and regional level. So we hope that you will find that working with us means you get a chance to connect more with partners in other states where we have programs, to work with folks we work with nationally, to have federal regulatory expertise at your fingertips, or in this case, right on the Zoom screen with us, so that you get the sort of full range of services and expertise that we have from other funders as well. So I just have a couple of slides I'm going to share. Mark, can you give me a thumbs up if you can see that? Okay, so I like to show this picture because I think lawyers are not always considered the most accessible or friendly folks, but we are different at PHLC. Part of that is because we're all public interest and equity-minded people, and part of that might be because we live in Minnesota for the most part. But these are all folks who work on our commercial tobacco control program. So we do have additional staff who do climate policy and healthy eating and active living, like Mike said, but these are all folks who work on commercial tobacco. And so you might interact with different people at any time. Mike Freiberg is the lead of this program, and Colin and Esther are going to be doing a lot of work on it. But this is all the talent that you have on the bench at your disposal. And then I just want to share one other thing. So we have, as I mentioned, a few programs within our commercial tobacco control team. We actually started as the state legal center for Minnesota on tobacco back in around 2000. And we have worked continuously for the Minnesota Department of Health ever since. We're very similarly to New York, we're funded to provide legal technical assistance and other services to local grantees funded by the health department to protect health through policy. In 2019, we added the state of California to our state programs, and we have really enjoyed getting to work with communities all around California, and then now New York since March 1st. So again, welcome to the fold. Our state programs tend to have a deeper connection and involvement. We look forward to attending a lot of the meetings that you all already have and getting to know intimately the dynamics that shape policy change at the community level and in the state in New York. And also, using our expertise in other states and nationally to inform and improve the legal technical assistance we provide to you all. We also have a national program where we serve all of the states that don't have their own legal center. As you can imagine, it's a less in-depth involvement in the day-to-day of those grantees, but we are very pleased that we're able to provide our legal expertise to folks all around the country and sort of tailor and adapt the information we provide to the political reality and other kinds of considerations that are appropriate for each jurisdiction. That national program is funded largely by the Robert Wood Johnson Foundation, with also money from the Centers for Disease Control and Prevention. And then last but not at all least, we have our Fda Tobacco Project, which we launched in 2012 in response to the FDA finally getting regulatory authority over commercial tobacco products from Congress with the passage of the Family Smoking Prevention and Tobacco Control Act. And we use that project to really deeply understand and monitor the FDA's authority over tobacco products and how it's using that authority, and to push the agency to better advance health with that authority. And so you're going to hear a little more in depth about that from my colleague Desmond in just a minute. But these, I would say, taken together, we really think that these programs are greater than the sum of their parts, that we are grateful that we have the opportunity to experience such geographic diversity, but also that there's a lot to learn from each other. And so we feel fortunate that we're able to play somewhat of a role in helping folks do that who are working on the front lines of policy change. So we provide a lot of different kinds of services, and Mark is going to talk primarily about the first two here, but I did just want to mention that in addition to our bread and butter, which is what Mark will describe, we also are fortunate to be able to play a strategic thought leadership role nationally. And that really grows from our work with folks at the community and the state level, and our understanding of tobacco industry responses and tactics, and our understanding of sort of how federal activity fits with what's happening at the state and local level. And so we have, over the last 20 years, we have convened groups of advocacy and research experts to talk through thorny policy issues, public health lawyers to talk through tricky legal issues that are barriers to policy change. And we are able to write research papers to get into journals to help shape the sort of public discourse around policy options. And then we have also been able to advance our thinking on really critical pieces of public health policy change, including how equity needs to operate differently in public health policy change than it has historically, if we're going to reduce health disparities and meaningfully achieve health equity. How environmental considerations fit into commercial tobacco control policy, which has been a really exciting thing to learn more about. And then Endgame. So how do we pivot from just containing the catastrophe of commercial tobacco and the industry, and move instead towards an elimination of this harmful industry that doesn't need to exist. So that just gives you sort of a big picture overview. And then now I'm going to turn it over to my colleague, Mark, to talk about the specifics.
Great. Thanks, Joelle. This is going to get probably kind of redundant, but I do just want to echo what Joelle and Mike, and probably what Colin and Desmond and Esther will be saying later. But we are just thrilled to be able to get started working with you. We know all the wonderful work that's happening in New York, and we can't wait to be a small part of that and helping you move forward and saving lives. So as Joelle said, my name is Mark Meany, and I'm the Deputy Director of our Commercial Tobacco Control Program at the Center. I have also been at the Center for just about 10 years and have spent all my time at the Center doing commercial tobacco work. And I've done, mostly my work has been providing legal technical assistance. So I've worked national levels and on our state programs as well. And so I'm just going to talk a little bit about how we approach our legal technical assistance, and we certainly are open to any questions that you have. Feel free to jump in or put them in the chat. We'll have some time at the end, but if something pops up to you in the meantime, feel free to ask us. So our goal is really to make providing legal technical assistance and requesting as easy as it can possibly be for you. We want to lower all barriers, and as Joelle said, we want to make sure that you see that we're actually, we're nice, accessible people. Our goal is to help you out. So we really pride ourselves on providing individualized assistance to you. So we want to make sure that we are understanding your needs, knowing what your policy goals are, and helping you to achieve them. And as Joelle said, we work national. We have specific programs in California, in California and Minnesota and North Dakota as well, but a little bit smaller there. But we also work nationally. So we keep really a good sense of where policies are being implemented, what kind of policies are being drafted, where there's been litigation, and we always try to keep on top of the best practices for achieving certain goals. If there's certain language that is better, if courts are interpreting it, we keep track of all that, and we try to provide all that information to you in a condensed, usable form. We are generally, our team is primarily generalists, so we try to have folks who can help you on any policy area. There are some areas that are a little bit more specific, as Joelle mentioned. Tobacco product waste is a policy area that has become more, I think, more in the forefront now, both as an equity issue and just generally as a policy option. And I think that's something that it's a little bit more complicated with federal laws. And so we have a few people on our team who have specific expertise in that. But mostly, all of us can do any of the work that questions that you have, whether it's retail policy or smoke free, or of course areas like flavor or tax or anything like that. When we talk about legal technical assistance, this is something I didn't know at all when I started at the Center, so I always feel like it's good to give a little bit of background. What we're talking about is providing legal research and analysis, or policy development, whether it's drafting policies, reviewing draft policies, any of those aspects of it, to make sure that it's doing what you want it to do. We want to make sure that your goals are achieved, and that it's doing it in a way that is also least likely to be litigated. We know that we are working in a sphere with an industry that is not afraid to litigate, even when it's a losing effort. They can still win by just by mucking things up in the courts. And so we know that's not always possible to avoid, but we want to make sure that in the event there's litigation, that you're in the best position to succeed. And we do that through, as I said, through keeping track of where there's been other lawsuits, understanding the interplay between federal, state, and local laws. We work a lot with researchers in understanding where the evidence base is for policies. And then we all do all of this through an equity lens. And Colin's going to talk a lot more about this, but it's really important to us to work with the communities that are most affected, with social justice organizations, with health departments, with attorneys, to really understand kind of the whole spectrum of what policy needs are and policy goals and how to achieve them. And flavors, I think, is probably the best recent example of kind of pulling all of that together. And it's been, and I think the progress that we've made in that nationally has been really, really exciting. And Esther is going to talk more specifically about that. We work with, as Joelle said, really essentially every state in the country. So we kind of have we have a really good sense of what's happening around the country. We convene meetings. Joelle mentioned some of them. We also have regional meetings with state tobacco control managers, where we get a better sense of what policy priorities are, what legislative goals are going to be for the next session. And that helps to inform both our legal technical assistance work, but also the publications, presentations, all those other components of the work that we do. So that's kind of the main part. We have model policies, we do individual policies. We can do any of that for you, whatever's the most beneficial to you. And then the other part our assistance is presentations and publications. And so if there's anything you have a group that wants a presentation or training on any specific policy area, we're of course very happy to provide that. We work with you to make sure that we're getting you what you need. And then we also can do, we provide litigation support. So we don't do any direct client representation, but we do help when there is litigation, and that can be in the form of amicus briefs is the most common, which is when there is, especially a case that has some larger significance. We want to make sure that the public health interest is reflected in the court's record. So we file a brief that ensures that that's a part of it. And then we also have done when there's a litigation, often attorneys, it's city county attorney that is defending a law may not have that much experience in this particular area. So we'll help provide either educational background to them, even do kind of moot courts for them to make sure that they're ready for oral arguments. And then finally, I just want to say that we want to make sure, again, as I started off saying, it's as easy for you as possible. So while Mike is the lead on this, and you're certainly, he'd be a prime contact if you have any questions for us. But as you kind of get to know somebody else, we want to make sure you can, you're always open to to contact anybody who you've worked with in the past. Any of us can help you, and we're all happy to do that. And then finally, I want to say also, we're getting ready to put together a bulletin, a quarterly bulletin specific to folks in New York that will hopefully give you a sense of what we're doing and what we're seeing. But we do have a monthly bulletin that's national in scope. And if you're interested in that, you can certainly add your name and email address in the chat box, and we'll add you to that so you start receiving that immediately. And with that, I'm going to turn over to Colin, who's going to talk more about the equity focus of all of our work, and I think specifically some of the tribal aspects as well.
Yeah, thanks, Mark. I'll just take my turn to say how excited I am to work with all of you and be here and see some tons of new faces. And it was nice to meet some of you in New Orleans at the national conference a couple of weeks ago. But yeah, my name is Colin Welker. I'm the policy analyst for the commercial tobacco team. I've worked at the center for just a little over 2 years now. And I also work on our tribal law and policy work group within the center. I just want to share, like Mark has mentioned, a little bit about the Public Health Law Center's thoughts on equity and our approaches. And what we really do is try to center equity in all of our work. And we do so in consideration of advancing health equity. So what that means is we're really committed to partnering with communities and organizations like you all to use the power of law and the power of policy in a way that addresses the social determinants of health and meets the specific needs of all different communities, especially those who unfairly bear a greater burden of health inequities, often caused through systemic racism in the commercial tobacco industry, as well as other societal harms. So we really aim to bring in and elevate the voices of these most impacted communities and put them at the forefront of our work when we can, and help link you all to different partners that can really elevate those voices as well. So we don't really believe that equity is achievable through a one-size-fits-all approach. And so we're really here to assist you in tailoring your policies to be solutions that best fit each of your unique communities. Just an example. So for example, language is so important in law and policy, but not just so it can have a clear definition or hold up in court, but sometimes it's really connected to community and culture. And so I'm really proud to work somewhere where we think about these things, like the idea of using the term commercial tobacco instead of just tobacco control. You'll hear us throughout today and from now on refer to ourselves as the commercial tobacco team or refer to it as commercial tobacco control. And we do this because we recognize that many indigenous communities use traditional tobacco for ceremony, prayer, offering, or in different things. So it's very important that every time we begin presenting in our publications, we make a clear distinction that we're talking about laws or policies that address the commercial tobacco product, not the traditional use. And oftentimes, well, we tend to limit our exemptions in policies. We may have one for traditional use. And just like I mentioned before, if possible, we try to have this led and defined by tribal leaders or elders. That's just a little bit about how we approach equity at the center. And now I'm going to pass it over to my colleague, Desmond Jensen, to talk about the work we do with the FDA.
Thanks, Colin. So this is where I say obligatorily that it's a pleasure to work with all of you. It really is, but apparently we're all supposed to say it as part of the script. So I'm the lead senior staff attorney for federal regulation at the Public Health Law Center, and I've been doing FDA work here for just shy of 10 years. Like, I started a couple weeks before Mark, so I have infinitely more experience and knowledge on commercial tobacco control. Right, Mark's nodding, so it must be true. Sorry, joking aside, our FDA work is something that we're really proud of, and hopefully something that will be helpful to you all as you're engaging with us in legal technical assistance work. It kind of falls into two buckets. We have all of the stuff where we are advocates for stronger FDA regulation. So we are, going to speak to the FDA, conferences, meetings, hearings, and things like that, and filing citizen petitions and pushing the FDA to do the things that we think they ought to do, which is exciting because it looks very different than a lot of our other work, where we're just trying to help other people accomplish their goals in the way that works best for them. But here we get to tell the FDA what we think it should do. And then the other bucket of things that we do, which is what you'll be working with us more on, is making sure that the broader public health community, beyond just folks who are in Washington, are engaging with the FDA, because their processes are very participatory. So whenever the FDA is sending out its announcements, we try to decode all of the jargon and acronyms and all the stuff that the FDA uses and make sure that it makes sense to you all and that you understand how what the FDA is doing actually affects what happens in the state of New York, which is, not the FDA's approach to communications. And that's, not an insult to the FDA. It's not what they do at all. So we're happy to step in and fulfill that role. And then the other thing is making sure that you all know when you have an opportunity to engage with the FDA. So right now, I'm sure everybody knows there's proposed rules out on menthol in cigarettes and in flavors in cigars. And if you go to our website, you'll find hopefully all of the information that you might need to draft your own comment, to submit to the FDA, or if you just want to sort of know what's in the rules, we have that sort of information too. And if the resources don't answer your questions, you can always feel free to reach out and ask us the questions as well. So that's what we are happy to do. And again, happy to work with you all in New York. FDA can learn a lot of lessons from what you've been doing already for the last several years. And then I just wanted to real quick, and I mean, if there's time for questions at the end, you can certainly shoot them to me or send them via email and stuff. But the big things that we're working on with the FDA right now, obviously, are the comments to the menthol and cigar rules that I just mentioned. Comments are due August 5th. So we're still far enough away that if you haven't started, you can probably still get something in, but we're getting pretty close. So get started if you haven't. And then obviously monitoring what the FDA is doing with pre-market review. So if there are questions about all of the strange, weird announcements that have happened recently about Juul, I'm happy to try to make that make sense for you all as well. But that's probably enough of me talking. I'll wrap it up there. I will hand it over to my colleague, Esther.
Thank you, Desmond, and good afternoon to all of you. As everyone has said, we are very much looking forward to getting started to work with the New York team, so we're really glad to have this event. My name is Esther Agbaje. I'm a staff attorney with the Public Health Law Center. One of the recent hires, I started in February and have been working with a lot of my time with the FDA team, and so working hard on submitting our comments that will be due soon, as Desmond just recently talked about. So for this portion of the webinar, I will start off with two kind of hot topics that we see are coming up, particularly in the commercial tobacco space, to ensure that people are aware of them, and then also the help that we can offer to those areas. So the first one is, of course, flavors. As many of you know, flavors in tobacco products other than cigarettes continue to remain on the market. These include flavored cigars, cigarillos, hookah, e-cigarettes. And e-cigarettes, as we all know, are one of the more dominant flavored tobacco products on the market. And this is concerning because youth are really enticed to this product. And so this is what, starts them smoking and also keeps them smoking. And we also know that vaping is also interesting because there is this wrong perception out there that it may be safer than traditional cigarettes, which we know is not true. So to combat this, as we've heard a little bit about, the FDA has actually proposed a product standard to ban flavored cigarettes and most other flavored combustible tobacco products. But additionally, there's also work happening on the ground in cities and states across the country who are implementing their own sales restrictions of flavored tobacco products, including those that would cover e-cigarettes. And so at the Public Health Law Center, some of the work that we've been able to put out really emphasizes some of the best practices we've seen in these bans on flavored commercial tobacco products. One of those is making sure that the ban is jurisdiction wide and covers the whole area. The other is to ensure that it bans menthols. Third is to ensure that it restricts flavors in all tobacco products. And then finally, that there's no exemptions for retailers. We find that when cities and other jurisdictions put forward sales restrictions like these, that they tend to do better. As we heard earlier, there's also a number of legal challenges that can follow when cities and states try to restrict commercial tobacco in their areas. The industry will usually attack these laws on kind of the basis of either it's a preemption claim or they're doing a dormant commerce clause claim. Retailers might also get involved in this, and they may challenge the vagueness of the ordinance or the state law, or say that that state law infringes on their due process rights. And we've also seen some equal protection challenges appear as well. And so while this litigation is definitely a significant hurdle and can be a significant cost, there's also hope because so far these restrictions have been upheld by the courts. And as Mark mentioned, we are here to help. We're here to provide legal technical assistance, helping you with researching some of the other cases that might be out there, and then also helping on amicus briefs in any other ways that we can support any policies that you may be interested in and wanting to put forward. And so part of the effort to remove flavors from the marketplace not only enhances just the public health of people across our society to prevent them from smoking and to help them to stop smoking, but it also ensures that we're actually having less of a harmful effect on our environment. Which brings us to our second hot topic, which is commercial tobacco waste. So this is we all know that commercial tobacco has, caused a public health harm to our society through smoking and secondhand smoke. But the environmental harms are now starting to appear much more readily. What we've known since the 1950s, particularly when it comes to traditional cigarettes and the cigarette butts, those are made of plastic and they don't biodegrade. And so what happens over time is they turn into microplastics, and that gets into our food and into our water. Cigarette butts also have the major problem of leaching toxic chemicals, so like nicotine, metal, and other harmful chemicals into the air and the soil and the water. And we also know that cigarette butts are some of the most littered items in the world, producing hundreds of thousands of tons of waste every year. Other commercial tobacco product waste includes plastic cigar tips that also gets into our waste stream. And then there's also the issue of the acute hazardous waste, which is what nicotine is classified under the federal minimum standards. So that means that there has to be specific ways to get rid of that waste. And what we're also seeing now is that there's increased waste from e-cigarettes. And that means because they're made out of plastic, metals, lithium batteries, and they often include really small amounts of those materials. And so that makes it really hard for recyclers and cities and states to have recycling programs that can effectively address the waste that's now being produced with the proliferance of e-cigarette devices. And so some of the questions that are coming up in this space that we're seeing is, how do we better dispose of these products? How do we hold the industry accountable who's manufacturing these products? And how do we support schools and organizations and even retailers that are now continuing to collect these harmful devices? And then finally, how do we implement and enforce stronger hazardous waste laws? So again, we're here as the Public Health Law Center to help you guys as you're thinking through what next steps and policies you want to move forward. We're also putting together research on ensuring that we are moving forward in the best way possible and providing those interested spaces in the policy areas. And so there's a couple other hot topics that we want to touch on. And so I will turn it back to my colleague, Mike Freiberg.
Thanks, Esther. So I'm just going to talk a bit about two more hot topics, multi-unit housing and endgame policies. So one area we've been doing a lot of work over the last few years is smoke-free multi-unit housing. People spend more time in their homes than any other location. So policies that protect residents from exposure to commercial tobacco smoke can greatly improve health. So we work with local governments, landlords, and property managers to find equitable solutions for residents living in multi-unit housing buildings. And multi-unit housing residences can vary from apartment buildings to condominiums and cooperatives to subsidized public housing. Now, each of these housing types comes with a unique set of legal arrangements, and we develop tailored policies that can protect the health of all residents. Now, smoke-free multi-unit housing policies can range from a policy that applies to only one single-family home to an ordinance that applies to all apartments and condominiums in a whole county. Just want to show you something here. Give me 1 second to share my screen. So the American Nonsmokers Rights Foundation has lots of great resources on their website. This is one that shows a list of cities and counties that have adopted ordinances for 100% smoke-free multi-unit housing. Just scrolling through here, you can see that there are a lot of them. There are 76 of them. However, if you look in the second column, you will see that they are all in one state, and that is the state of California. So we are hopeful that soon a city or county or even a whole state that's not in California will adopt one of these ordinances. And it's certainly possible that it could be in New York. We think it would be great if it were. But multi-unit housing policies, whether they are passed by a government or just passed by an individual property manager, raise several issues that you'll want to consider. So are e-cigarettes covered? Are outdoor areas covered? Is marijuana included? Are designated smoking areas allowed? Are condominiums covered or just apartment buildings? But beyond questions like this, whether you're working with a policy for a single apartment building or an ordinance prohibiting smoking in all multi-unit housing in your community, there are also important considerations related to equity along the lines of what Colin discussed. So just some questions you want to think through. How will the ordinance be enforced? What are the penalties for violating the ordinance by smoking in your apartment? Is eviction a possible penalty? Now, as public health advocates, the last thing we want to do is exacerbate housing insecurity by evicting people for using a product they might be addicted to. That has the potential to exacerbate other health outcomes because housing is a key social determinant of health. But at the same time, residents of multi-unit housing have a right to be healthy in their homes and to breathe clean air. And this is particularly true if they have a health condition that's exacerbated by secondhand smoke. If somebody is repeatedly smoking in an adjacent unit in violation of the law, and that smoke is harming a person next door to them, and the person who's smoking refuses to stop doing it after multiple notices of the violation, should they be evicted? There aren't easy answers to any of these questions, unfortunately. And we don't assume we have the right answers all the time, but we do try to make sure that you're aware of all the potential ramifications. You'll likely have to wrestle with some uncomfortable questions with no easy answers. We do it all the time at the Public Health Law Center. And next, I'm going to talk a bit about endgame policies. So in a 2016 article in the journal Tobacco Control, Ruth Malone wrote that, quote, "We do not require a single additional study to know with absolute certainty that the continued sale and use of cigarettes will reliably deliver more disease, death, and suffering than any other product," unquote. So the implication is clear. We should look to ways to stop the sale of commercial tobacco products, particularly cigarettes. Now, when people think of the term endgame in the context of commercial tobacco products, they may think of an outright prohibition on the sale of all commercial tobacco products. And the cities of Beverly Hills and Manhattan Beach, both in California, have passed policies along those lines. But there are a range of policy options that could fall under the umbrella of the term endgame. Now, not all of these are appropriate for state or local governments to consider, but policy options could include first, reducing nicotine levels to sub-addictive levels, and the FDA is starting to look at this possibility. Another policy option could be prohibiting additives that increase the palatability of commercial tobacco. A third possibility could be reducing the number or the location or the type of tobacco retailers. Just as one example there, Bloomington, Minnesota, in my home state, passed an ordinance sunsetting the issue of new tobacco retail licenses. Another policy option that could be considered an endgame policy is raising the minimum legal sales age to something higher than 21. Brookline, Massachusetts passed a policy phasing out the sale of tobacco products to anyone born after January 1st, 2000, although a lawsuit was filed over that ordinance. Another policy option would be prohibiting the sale of a class of tobacco products like combustible products. Now, there are legal issues you'll want to consider if you think about any of these policies. Esther spoke about some of the legal issues. State and local governments don't have the authority to adopt product standards, but they do have the authority to regulate sales of commercial tobacco products. So many local jurisdictions have passed laws that restrict the sale of any tobacco product with a flavor other than tobacco. And that flavor often in these laws does include menthol. State and local jurisdictions couldn't require tobacco products to be manufactured without flavors or menthol. That would be a product standard, which is preempted by federal law. But they can prohibit those products from being sold in the jurisdiction. The Tobacco Control Act is clear that state and local jurisdictions have the authority to regulate the sale of tobacco products. So just some key takeaways on the endgame topic. The industry, the tobacco industry, is deeply concerned about sales restriction momentum. And in every federal preemption challenge to a tobacco sales restriction so far, the court has upheld the sales restriction. Regardless of the track record, the industry is likely to keep suing. Just one quick point to make before I wrap it up here. The endgame terminology may not be appropriate in all settings. If you're working with a community that uses tobacco for sacred purposes, speaking about the tobacco endgame has the potential to alienate them because it may sound like you're trying to eliminate a cultural practice. So you'll want to be careful about terminology as you do in any policy area. So that wraps up the hot topic portion of the presentation here. I just want to share my contact information really quickly with you. It'll pop up on the screen here, and I will also paste it in the chat. So this is that's my office number there. We are working mostly remotely, so email is probably a better way to get a hold of me, but any voicemail left at that number does also get delivered to me, so I can call you back if that's the best way to reach you. This also has our website, our Twitter handle, our Facebook handle. You can reach out to us. The grant has been executed. We've had our introductory webinar. So any technical assistance questions, we'll be glad to start fielding them. And one additional point I wanted to make too. I know you have work groups that meet regularly, and we're glad to be able to start attending those. We'll be attending all of the ATFC monthly meetings. I know the next one's on August 9th. But I know there are some groups working on specific topics meeting before then. We'll try to attend those periodically. I don't know that we'll make it to every subgroup, but if there is a meeting you think would be helpful for us to be at, please reach out, and I can make sure that at least one of us is there at your meeting. Now, as part of this project, we're fortunate to have the expertise of Mike Sielbach and Thomas Carr of the American Lung Association. Mike and Thomas will be helping us with various aspects of the contract, and I know many of you have worked with them previously. So I did want to give them the opportunity to say a few words before we get to Q&A. So I'm going to turn it over to Mike Sielbach right now.
Great. Thank you so much. It is so good to be on the Zoom with all of you. Many familiar faces and names, and many new ones too. So I am excited. My name is Mike Seelbach. I'm the National Assistant Vice President for State Policy and for the American Lung Association. And in that role, I oversee the organization's state and local advocacy efforts. But I've been with the Lung Association in New York for 17 years now. And so I really am happy to be part of this project, which will allow me to have some more hands-on work in New York itself. And so what we are going to be doing is serving as a resource for PHLC and all of you to help sort of bridge for us non-lawyers on the call. Despite my parents' best wishes, I am not an attorney and not becoming one. So we are going to serve that resource for all of you. That is not going to prevent your work with, for example, Trevor Summerfield, who many of you know as our advocacy director in Albany. He's still going to work exactly the way he did before. It's going to be an additional resource. And so the bottom line is, when it comes to our work with all of you, Thomas and I are here as an additional resource. Do not hesitate to reach out to me as a point of contact, and I can get you in touch with Thomas, or if it's more appropriate to be a direct lobbying question or advocacy question, get you in touch with Trevor. Again, we are super excited. We've worked with PHLC on their program out in California directly. And I've been lucky enough to work with BTC and funded partners for many years. So we're excited to leverage that. I'm going to hand it over to Thomas, who I'm so excited to bring into the project and introduce him to any of you that don't know him yet, because he is our tobacco expert for the Lung Association. Tom.
Hi, everyone. Thomas Carr. I'm, as Mike said, I'm National Director of Policy with the American Lung Association. I'm based in our Washington, D.C. office. I've been with the Lung Association for 18 years now. So, and I've been doing tobacco policy work and providing technical assistance to our state advocacy leads and other constituents of the Lung Association for pretty much all of that time. So I've been doing other tobacco policy research and things. So I've got both a foot in, I've been doing state for most of that time, but state and local, but I've also recently got more of a foot in the federal policy areas, tobacco policy areas as well too. So look forward to bringing that expertise forward in this project. And I think that's probably all. And then look forward to working with everybody on this call, everybody that needs our help. So.
Thank you both. We're just a constant theme here is we're excited to be working with you as well as with all of the grantees. So it'll be great having your New York-based expertise as part of this contract. Really appreciate the work you guys have done in the area of commercial tobacco control. Thanks, Mike Seelbach posted his contact information in the chat there too. So that's how you can reach him. So we wanted to make sure there was time for some questions. Looks like we have about 15 minutes or so. So you're welcome to raise your hand if you have a question, and you cannot unmute yourself, or you can post a question in the chat. Just to get things started, we did get a question that came in through the registration process. The question is, will you be able to work directly with municipalities or counties that are interested in adopting a retail policy in terms of offering guidance and best practices, not legal representation? That's a wonderfully worded question. Hopefully we covered a bit, but yes, absolutely. That is, retail policies are definitely something that we can work directly with municipalities or counties, as long as it's not legal representation or lobbying. So there are some limitations if, that would prevent us from working directly with elected officials. So, city council members, county commissioners, that sort of thing. Although there are circumstances under which we can do that, but it's pretty unusual. But more often we're working with the health department or local advocates on retail policies, but that is an area we work quite a bit. So I see a comment from Heather Bennett. I will, let me just copy and paste that so I can make sure that gets on one of our schedules. We'd be glad to attend that. Megan Dubois, you see you have your hand raised. You're welcome to unmute yourself and ask a question.
Wonderful. Thank you so much for sharing that, Mike. That actually was one of my first questions as well. We'll be in touch shortly from Power Against Tobacco. My other question was, my colleague Molly had asked, we have toolkits from our prior policy center that we've been utilizing for years. We're wondering if you'll be able to help us update them, and if so, if there'd be a timeline for that, because we are in desperate need.
Sure. Yeah, no, yes, the short answer is yes. I mean, preparing publications that are New York specific is, there's a clear part of this contract. So we haven't yet mapped out exactly what order they will happen. And I'll be working with the BTC team And I've already had some preliminary discussions with Cheryl and her team about this too, about the order we'll do that. We do have lots of publications. They may not be New York specific, but we do have a lot of timely publications on our website. If there's a specific topic you're interested in, feel free to reach out to me or anyone on our team. And, it's possible there's something that is fairly up to date on our website that may not be New York specific, but that covers the topic you're interested in. And we can certainly provide that to you. I don't know if any of my colleagues, Joelle or Mark or Desmond or Esther or Colin, feel free to jump in if you have anything on any of these too. You have some great background images, by the way. I'm looking right at you, Jonathan Chafee, with the alligator. Is that your head in the alligator? Okay. I'm looking forward to working with you in particular, hearing the backstory for that. Let's see. Diane Patterson says, is contact info for today's Law Center speakers on your website? Yes, it is. We can post all of our contact information is on our website. That includes email addresses and phone numbers. I can post one of us, Stephanie or one of us can post the about, if you just go to about us and then our staff, I think is the way to get there on our website.
Mike, do you see Makita James's?
Oh, I'm sorry. I do see that now. Yes, Makita, please.
Hi.
James.
Yes,
Hi.
good afternoon. Can you hear me?
Yes.
Wonderful. Makita James here with the Center for Health Systems Improvement with CAI. Quick question. We'd just like to know, in what ways can the Public Health Law Center support the work of health systems grantees? There are a number of Medicaid policy initiatives that we'd like to address surrounding things like pharmacists being able to dispense NRT products without physicians' prescriptions, without HCO reimbursements increasing. So would the Public Health Law Center be able to support us with work around that? Thank you.
We can certainly take a look at the policies that are in place. I mean, typically we do work less frequently in those areas, but we do get questions that come up about cessation coverage or prescription guidelines as well. I don't know, Joelle or Mark, do you have any comments on that area?
Well, I would just say that we have done very similar work in Minnesota that I think would be, kind of help us to get a better understanding. But it's, we'll look at the authority issues and see, it's, I think it'd be more working with you more directly to see what, what it would look like. But we have done some work in there. Yeah, and happy to work more with you on it.
Okay, thank you. I'll reach out directly. Thank you.
Great.
Okay, and Jeannie, I see your comment about the smoke-free housing call, and so I've made note of that. So Teresa asks in the chat, when we have a specific question, is there a first contact point person we should reach out to, or a particular point person for different topic areas? I would say you're welcome to, I'm the interim lead of the New York team, so you're welcome to, I can certainly be the initial point of contact if you're uncertain. If you're in New York and you're uncertain of who to contact, but it doesn't need to be if you have a regular work. If there are times where, say Esther or Colin might be working on a specific TA request and just develop a relationship with somebody. You're welcome to just reach out to them. The short answer is, whoever you contact at the Public Health Law Center, will make sure it gets to the right person if it's not the person you ask. So I wouldn't worry too much about it. If you're uncertain, I can be certainly the initial point of contact also. I have heard from BTC that we can expect a lot of emails. So I won't lie and say I'm not nervous about it, but I am, as is the constant refrain today, I am excited to begin this work. So I'm excited to see what comes in through those emails.
There's a question from Judy Reitmeyer about review of a new municipal and state park bill. Yeah, we can look at that, Judy. If you send it to Mike, he'll triage it to the person who has capacity to review and get something back to you.
All right, thank you.
You're welcome.
Yep, and actually, yeah, we've actually already received a question about that too. So that's a timely one. But yes, if you have a specific question as well, please reach out. I'm sorry that I think that I'm trying to track. Yeah, any of my colleagues, if I miss a text or a hand up, please let me know, as you've been doing. Any remaining questions? We certainly don't need to stay on here all the way till 1 if questions have been answered. But as I said, if you have any, TA requests, feel free to reach out to me, and I can, if I'm not the one who handles it, I'll make sure it gets to the right person.
Can I just add that there are other resources on our website that you might find useful and relevant. We track litigation, and so we have information about each case that hopefully gives you an idea if it matters to you or not, in terms of whether it affects law in your jurisdiction, as well as amicus briefs that we filed. So that's kind of all one tool. We also have an administrative action tracker for FDA and other federal agency actions. And then just our FDA Action Center in general. So for example, if you are looking to submit your comments to the FDA, and we have draft talking points, all the things Desmond talked about, but I just encourage you to spend a little bit of time poking around the website, because I think you'll find that a lot of the work we've been doing all along is useful and relevant. And then if there's something we have that you would like tailored for New York, we really welcome your input on that. We want to focus our time and efforts strategically in the way that is most beneficial to all of you and your work. So if you see a model policy for a California issue that you think you would love to have a comparable tool for New York, we welcome that sort of guidance from all of you.
I should also mention, we will have it's not up there yet, but we will have a New York specific portion of our website. So all of the materials we develop specifically for New York that'll be kind of the landing page for there. That could go up very quickly. I know this webinar is being recorded, so this might be the first interactive thing that goes up on that website. But as soon as that's available, I'll make sure, I'm sure the BTC team can make sure you know where it is.
I'm so glad that Mike added himself as in your group photo. That's a kind of perfect introduction for you to Mike, actually, and to kick off this wonderful working relationship.
So I'm just looking through the chat. Thank you for the, oh wait, okay. Oh, okay. I remember doing that, Susan. So glad to know that was me. I wasn't sure what Joelle was referencing there. I'm trying to get caught up on the chat messages here. So yeah, whenever anyone asks me to take a picture of a group, I usually then do a selfie version and add me in it, even if I have no idea who they are.
I thought you looked familiar, so I was like, oh, I think I've seen this guy before. Let me look at my photos.
Sure.
Nice to meet you.
Nice to meet you too. Nice to meet you again also. So
yeah.
Under this service. So yep, thank you, Jennifer. We're really excited to work with you as well. Thank you, Mike Seelbach, for the nice comment in the chat there. Stephanie has posted a link to our California specific website, and that's kind of what the New York one will be modified after. Joelle, I see your message there. Was there something you wanted to say?
Well, I just thought that it's interesting maybe to all of you to know too about Mike and Esther on our team, that in addition to being fabulous technical assistance providers to you, they also have another job, which is they are state legislators for Minnesota. And so while that makes them real busy, it also means they have a unique perspective on the policy change process, I think. And we just feel really fortunate to have that extra layer of expertise and experience added to the New York program.
Thanks. And just so you're aware too, on that, I don't always bring that up, but we are in Minnesota, we do have a part-time legislature. So a lot, I know in New York, I believe there's actually a law that says legislators can't hold other jobs, but in some states there are part-time legislators where, where we hold other jobs. So hopefully it does bring us some perspective on the policymaking process that can supplement what's already there. But regardless of whether or not our staff is also a state legislator, I can assure you everyone at everyone at the Public Health Law Center is very qualified and great at and very excited to respond to your TA questions. Diane, I see you have your hand raised.
Hi, how are you?
Good, how are you?
I'm well, thank you. I just took a look at the California page on your site, and I saw that, for example, you have a a model policy, tobacco-free policy for a faith-based organization. And it made me think, some of our grantees are working on a menthol campaign related to the LGBTQ plus community. In fact, it's a campaign where we've focused on the African-American community and the targeting of youth and the targeting of the LGBTQ plus community. Is there anything you have that relates to that community? Anything you've developed that relates to the LGBTQ plus community? And like I said, the faith-based was just, it made me think, oh, you have things that are tailored to different communities.
Yeah, no, we are absolutely interested in tailoring products to specific communities, and the LGBTQ community is a very important one that's been targeted by the tobacco industry. So if any, I haven't worked on any specifically. I see Colin, you unmuted yourself.
I was going to say, yeah, we've developed actually with our California contract a video about kind of how the industry has co-opted this gay liberation movement from, as early as the 1960s, 70s, and 80s on, and continue to do so today. So it's in its final stages, but that will be out soon.
All right,
so
thanks,
we
Colin.
have, and I'm happy to help work on that and share any research I have after diving into the industry documents and things like that.
Thanks a lot.
Great. Yeah, and Stephanie posted a link to a webinar in the chat too. That was
Excellent. Thanks, Stephanie.
Yeah, and if you know of a specific resource that we don't have that you think we should, please let us know and we'd be happy to work on that. I do have the time as 1:57 Eastern time. We're on Central time here, so hopefully we're used to working across the country, so we're pretty good with making sure we're talking about the correct time zone. So that so hopefully that won't be an issue going forward. But I do want to be respectful of people's time. So thank you very much. Really appreciate this opportunity to let you know who we are, and because we can't say it enough, we are really excited to be working with all of you. And I think this will be the start of a great partnership and a lot of really important policy work that will save lives. So thank you for your time, and hope you all have a great rest of your day.